Hello, everyone. We will give everyone a chance to join the webinar and then we will get started. All right, my name is Rachel Bromley and welcome to TMA's Empowerment Clinic on Managing Myositis through Psychosocial Health. Again, I'm Rachel Bromley and I'm TMA Senior Manager of Patient Education Support and Advocacy, and I have a couple of guests with us today. One of our medical advisory members, Dr. Nicole Voet, and one of our brand new myositis members, Chip Galloway. So we will hear from both of them, and then we will take questions from you, the live audience. And if you would like, you can put your question in the Q&A box at the bottom of your screen. But right now, I'll go ahead and bring in Dr. Voet, and you can tell us a little about yourself.
Yeah, thank you, Rachel. And thank you very much for the invitation to talk to you here tonight, for me in the Netherlands, maybe for you in the afternoon or morning. And I'm a rehabilitation physician. I work in a rehabilitation center in the Netherlands and also in the Radboud University Medical Center, an academic medical center in Nijmegen, the Netherlands. And in both centers, I see patients with myositis in the clinic as well as for research. I now have 3 main projects regarding research. One project is setting up a care network for people with neuromuscular diseases. One project is on muscle fatigue and pain in neuromuscular diseases. And the last project is regarding psychosocial health in neuromuscular diseases. So yeah, very important also for tonight.
Thank you so much. You are free to share your slides.
Yeah, I will do now. And as always, the question, can you see my slides? Yeah.
Yes, we can.
Yeah, I only have got 15, 20 minutes. So in these 20 minutes, I will give you an overview regarding managing myositis through psychosocial health. And first of all, I do this on behalf of the Inspire NMD consortium group. It's set up after the international workshop we organized last year, May, in the Netherlands. It's an international group of psychologists, occupational therapists, physical therapists, neurologists, psychiatrists, researchers, patients, and not to forget patients. And this workshop was about psychological interventions for improving quality of life in slowly progressive neuromuscular disorders. And what I tell you now in the next 15 minutes is based on all the findings we discussed together in this workshop. And as I said, I only have 15 minutes, so I have to focus. And I will focus on psychosocial issues before and after the diagnosis and during progression of myositis. I will focus on the patient, him or herself, and on adults. But of course, caregivers, family members, children are important too. But because of time, I will focus, and I will tell you some more about an intervention, acceptance and commitment therapy, because there is research on the positive effect of acceptance and commitment therapy in myositis. And having myositis creates a psychologically very challenging context because of course, there are symptoms. You have to manage with these symptoms on a functional level, functional impairments, pain and fatigue. Sometimes you have to use medication, you have to go to the physiotherapist, and it all has an impact on social functioning, on work, sometimes also a financial impact, an emotional impact. You can have feelings of fear, anxiety, a low mood, and to end the identity. Many patients ask themselves, who am I now? Am I a person with myositis? Am I myositis? So the identity is very important too. And in 2005 and 2012, patients with neuromuscular diseases were asked, what is the burden of disease? What makes the burden of disease? And of course, muscle weakness is a core symptom, but there is more. Patients indicate that they experience fatigue. More than 60% of them experience fatigue. Pain is common. Almost 80% of patients experience pain. Sleep disturbances are common. And with all that, it's very difficult to be physical active. So physical inactivity is an important problem. Another research was about determinants of health. And you can see these determinants here in this diagram. And medical care is for only 11% a determinant of health. So I'm not very important as a physician, only 11%. Genetics and biology, so the cause of the disease, determines 22% of health. The environment is important, but the most important things, these are individual behavior and social circumstances. So talking about health, psychosocial determinants are very, very important. And I think that in medical care, we not only have to focus on the medical part, but these other parts, cognition, behavior, psychosocial determinants are very important too. And therefore, I'm happy that we have this group of researchers, clinicians, therapists, patients, Inspire NMD to work on these components. And prior to the workshop, we sent out a questionnaire on treatment considerations in the care of people with NMD with a focus on psychosocial care. And patients, close relatives, professionals all answered the questionnaire, almost 300 participants for this questionnaire. And the input was from all over the world, also from patients with myositis. And it appeared that the problems patients experience, but also professionals, caregivers, family, was all general. It was not disease specific, but general. And on the physical level, people talked about the loss of function, loss of abilities, and with that, the loss of autonomy and independence, the body change, the chronic symptoms, as I told before, the experience of pain and fatigue, but also the consequences for sexuality, for procreation, and when the disease is heritable, for heredity. Then on the social part, of course, it can have influence on relationships, family, work, and stigma is also a very important problem. And the last part is the psychological part. Patients can experience emotions, but also caregiver can experience emotions like fear and shame. A disease can be unpredictable. What does the future bring? And patients and caregivers and professionals say it's very important to understand the disease and its consequences, because it helps in accepting the disease and its consequences, and also the acceptance of body change, mentioned very frequently. And when we take a look at the different stages of the disease, there's an early stage, the stage before the diagnosis. And that was something very important for me to hear from patients. I always see patients after the diagnosis because I'm a rehabilitation physician, but there's a part before the diagnosis too, when it's unclear, when there are complaints, but you don't know what's the diagnosis. And in this stage, there can be feelings of depression, anger, fear, questions like why me, why now what, and fear for the future. There can be feelings of guilt and doubt. And we do not have to forget that, of course, it affects the life of the patient, but it affects the life of the partner, the loved ones too, because of the disease. And there can be a difference in knowledge between patients. I frequently see patients with hereditary diseases. And in that case, you can be the first one in the family, but you can also be the second one or the third one. So there's a difference in knowledge between patients when it's a hereditary disease. And patients have a need for reliable information, and you do not always know if the information you get is reliable, and where you can get information from. And myositis is a rare disease, so there's still a lack of information not only for patients, relatives, but also lack of information from healthcare providers. And after the diagnosis, it's important to understand the disease. I always educate my patient, because when you know the disease, the consequences, the causes, it's better to cope with the disease and the consequences. And many times it's important to know that you're not alone. And some people like to have peer support, and there are peer support groups. And you have to try to live with your limitation and adapt to a new reality. And unfortunately, it's not once, but it's twice, 3 times. There are several times when you have to adapt to limitations. And then you have to accept the pathology yourself, your new self, your limits, changes, loss of opportunities, problem situations. So consequences are huge. And then later stage, further on, it's a slowly progressive disease, and there are cutoff points for disabilities. For example, when you first use walking aids. And what I learned is that using a walking aid sometimes makes you from an invisible patient to a visible patient. But now, because now your family and friends can see that you have limitations, and it's a confrontation with inevitability. So that helped me in prescribing these walking aids. To understand that it's not always very easy to accept walking aids. And people are going to ask questions. I have one patient who uses crutches sometimes no walking aids, sometimes a wheelchair, sometimes a walker. And when she was on holiday, a woman came to her and asked, why do you use sometimes crutches, sometimes wheelchair, sometimes walker? I don't understand. And then the patient said, I don't understand too. And I think that's a very helpful answer. Indeed, it was for her. And of course, it changes. So you have to struggle with accepting more and more assistive and changing devices. But also the acceptance of help. Sometimes you have to accept strangers in your home. You have to learn to ask for help, to be dependent on helpers, and to lose sometimes autonomy. But I think as healthcare providers, it's important that we help people to be autonomous in daily life. And you have to learn to instruct your helpers regarding your wishes and preferences. You have to learn to explain your disease to others. Sometimes you don't want to. Myositis patients often have problems in swallowing. So when they go out and go for dinner with other ones, patients often ask me, do I have to educate or to tell other people the problems that I experience? Because you have problems with swallowing, and sometimes other people ask, what is going on with you? So that's a very difficult question. And there's no one answer for that. It's what helps you as a patient. And sometimes patients pretend to do or feel better than they actually are because of their loved ones, to reduce feelings of helplessness or worried by loved ones. But it's not always helpful in coping, because there's a great risk of overuse when you pretend to feel better. Sometimes people feel that they have to justify themselves for their disability permits, benefits, discounts. There can be a feeling of isolation because of, for example, problems with swallowing and going to a restaurant. And sometimes also problems with communication. So, all these consequences on a psychosocial level. And in general, what I've learned is that patients want to feel normal, just like anyone else, not to feel different, not to feel at fault, not to feel alone, not discriminated. So I tried as a rehabilitation physician to help people feel normal. And that can be different between patients. Some short words regarding families and the influence on families. It's important to know that people want a balance in give and receive between partners, between parents and children. And when you have a disability, there can be a disbalance in giving and receiving. And to stay in balance, it's important to acknowledge and to give credits to each other. And it's important to see that there can be a disbalance. And regarding children, children can be very loyal. And it can be very powerful, but please be aware that sometimes it can feel bound to stay with parents when they have myositis to help them. Or when it's heritable, they can feel guilt about having or not having the disease. And the other way around, parents may develop guilt about transmitting a genetic disease. So important to know the consequences for family. Some last words regarding psychological interventions, because I'm always ahead of time. Of course, it's very important to know that there's not one psychological intervention. There are several, and it's good to see what's the treatment aim. Do you want to have a better mood, to live with pain or fatigue, to increase your quality of life, family function? Then there's a different configuration, the medium, for example, online or physical, the one who can deliver it. It can be a psychologist, but also a social worker, spiritual worker, social worker, etc. The duration can depend. It's only one session is sometimes enough. Sometimes it takes more time. And then there are different approaches. Cognitive behavioral therapy, acceptance and commitment therapy, a psychodynamic approach, capability approach. So there are very different approaches and different techniques, focusing on thoughts, feelings, relationships in the past. Then very important for me that the needs are heterogeneous. And it's important to give care personalized. Capability approach we have in Nijmegen, the Radboud University Medical Center. So I always say one size fits nobody. So it has to be personalized. Then the last one is about acceptance and commitment therapy. It's more or less a new therapy, psychological therapy. And it's good to know that it's not about feeling less bad or feeling better, thinking positively, realistically, not catastrophizing, but it's about open up to do what matters to you, to know your values, to take different perspectives on your problems. Mindfulness is part of it. And the aim is to let the painful emotions, anxiety, painful thoughts, they might be there. They are there. And what the aim is to coordinate your life around the things you want, the values for you, instead of living to keep pain, distress, discomfort away, because they are there, but don't let them be in control of your life. You have to be in control of your life. So in the end, I always end with take-home messages for you, but now I end with take-home messages for me as a physician, what I've learned in the workshop and on the questionnaire, that there are similar concerns and problems over all these different types of neuromuscular diseases and myositis. But there are different ways of facing the problem and coping strategies to apply. Because the context of all these patients is different and the personalities are different too. So there's a need of a personalized and individualized attention with a holistic approach, not only the medical approach, but also the psychosocial, spiritual approach. And also regarding education, some want to know all about the disease and others don't want to know anything. And as a physician, it's very important to know, is it the one of the other? And the problems are maybe more or less general, but the interventions and approaches are individualized to help to achieve the same goals. And that can be acceptance and commitment therapy, cognitive behavioral therapy, mindfulness, support groups, spiritual care, and physical activity too. So the last one, the take-home messages, is that of course, there are 600 different types of NND and several types of myositis, but there are billions of people in the world. And regarding psychosocial intervention, it's very important to know who are you and what do you want to increase your quality of life. So a bit ahead of time, but I hope it was all clear to you.
Go ahead and stop sharing, please. And we've got a question about there are other interventions like compassion-focused therapy, CFT, and mindful self-compassion, MSC. Have you considered using any of these or other MBIs, mindfulness-based interventions in your research or with your patients?
Thank you very much for this interesting question. I don't know if the same person a couple of weeks ago sent a mail to me regarding the compression therapy, and I've looked into that, and it has some similarities with the acceptance and commitment therapy. And we do not subscribe it in the Netherlands or in the centers I work, but I think it's a very interesting form of therapy. So maybe, and that's what I told you, there are of course problems in general, but the approach can be different and the types of interventions too. So I think that we have to take a look what a person wants, and that type of intervention can be very promising. But there's no research, as far as I know, on this type of intervention in myositis. There is, I didn't tell you, but there is research on acceptance and commitment therapy in myositis with a very positive effect on quality of life, on mood, on even physical functioning. That's one thing. And the other thing is regarding mindfulness. Mindfulness is part of acceptance and commitment therapy. So in that way, also very helpful for patients.
So I was a little, let me add me so I'm not just like the voice of a higher power talking. There I am. Okay. I was curious, the part that you said that you have patients that want to know everything about the disease and patients that want to know nothing. And I am assuming that everybody on this webinar actually is in the other camp where they want to know or they wouldn't be here at all. But how do you ascertain which one they are?
Yeah, it's simple by asking the question, what do you want to know about the disease? And a couple of weeks ago, I had a bit of a problem because there was a patient and a partner, and the patient wants to know everything about the disease and the partner not. Sometimes it's the other way around. But that's a bit of a difficult problem. But yeah, then you also have to personalize. But more importantly, I want to know, why does a patient doesn't want to know anything about the disease? Sometimes it's because he or she is anxious or fear for the future. Because it is important to know more about your disease. And I'm happy all the people who are here now, who are in the category that they want to know more about the disease, because it can help you coping and help you know what the future will bring. So when people don't want to know anything, it's important to know why, what's the cause, and if you can help them.
When I looked up psychosocial health, it was categorized in four categories: mental, social, emotional, and spiritual. How do you feel those categories really align? Are they comprehensive? Do some of them overlap? Is anything missing from those categories? Because you kind of touched on social. I definitely saw that. And you touched on the psychological, the mental. Was there anything you wanted to say about the categories?
Yeah, you cannot distinguish them totally. They are indeed connected to each other. And what I think it's very important, sometimes people think that the mental part is for the psychologist, the social part is for the social worker, the medical part is for the physician. But in offering an intervention for myositis, we have to work as therapists, physicians together, because it is connected to each other. And sometimes as a physician, I talk about the social part, and sometimes the social worker talked about the psychological part. So you cannot distinguish it from each other. And many interventions, for example, acceptance and commitment therapy, takes a look at the psychological part, at the social part. For example, what is important for you in social participation, and what's your value? Do you want to work? And if it's not possible to work, do you want to do voluntary work? Want to play music? And of course, the spiritual part. Not so long ago, I talked to a spiritual worker, and I've learned that part was missing in my therapy. So from then on, I help people with finding a spiritual worker, because that's the puzzle I missed in offering care to patients. So it's all of them. It's not only medical part, psychological part, social part. And I think that in the future, In the past, we focused on the medical part, and in the future, we have to focus on all the other parts of psychosocial health.
Well, we may have more questions for you a little bit later on, so hang tight. But right now, I'm going to bring on Chip Galloway. Chip, hi, how are you doing?
Fantastic. How are you today?
I am doing great. So I said you're new to myositis, like it's some type of party. It's an exclusive club. Hello, you're in it now. Yay.
I would say I'm glad to be here, but I'm glad to be a part of what we have going on here.
Yeah, that is so true. And I have appreciated your efforts. So why don't you tell us a little bit about who you are and how your diagnosis came about?
Okay. Well, first off, before I get into that, Dr. Nicole, that was fantastic, because as you're speaking and going through your slides, I'm going, yeah, I was there. Yeah, I had that thought. Yeah, I had that question. I had that stage I went through. And it's encouraging to know that somebody has taken the time to go through and do the analysis and help me understand how I'm feeling. Now, I was diagnosed with inclusion body myositis in January of 2020. Started having issues over the years, and it had to do with climbing stairs. I tried to climb 7 flights of stairs. When an elevator was out and had issues, shrugged it off. I played basketball with my 3 boys, and they're adults now, and I would fall, and we would just shrug it off, and they said, Dad, we got 2 good moves for you, just can't keep up. I would shrug that off, and then I started having more issues and standing issues and issues with my hands. So in February of 19, I met with my primary care physician, told him about the issues, finally got in to see a rheumatologist at the Medical University of South Carolina in September of 19. And I was diagnosed from September to January with inclusion body myositis, that's rapid. I have a lot of faith, a lot of prayer going through, and I asked for eyes to be open, doors to be open, people to see. And for 3 years, I didn't want to know an awful lot about it. And the reason why I didn't want to know an awful lot about it is when we go through life, there's bliss not knowing what our future holds. Then all of a sudden I get a disease that's going to tell me what my future can hold. And I don't want to be a part of it. So I just treat the symptoms and go day to day. And earlier this year, I decided to make a difference in somebody else's life by being an encourager in the life that I was given. And it has opened doors and turned me on to things to where I really want to help other folks. And I'm excited about, for lack of a better way to put it, I'm thankful God gave me the disease He gave me to give me the boldness to be able to go out and help others that I normally wouldn't do. And I know that sounds a little crazy that you'd be thankful for something, but I'm more happy and more content in my life right now than I probably ever have been, because now I have a purpose.
How are you manifesting that purpose? In what ways?
Well, one of the things that came out, it was real funny. Talk about using aids. And I don't want to pick up a cane. I do it when I walk now. I need ankle foot orthotics, and I didn't want to use that. So I got ankle foot orthotics in July of last year and ended up going to Johns Hopkins, and the physical therapist was there. And I encouraged him with what the ankle foot orthotics could do. I went from 900 feet in 6 minutes to 1,492. And I told him I was improving, getting better. And I kept telling him to watch me turn, and he was laughing and having a good time. And I was encouraging him, encouraging me. So the purpose that I think I have is I'm only 53. I got diagnosed early. I still work 40 hours a week. I'm an accountant. I can get out and do. I teach Sunday school at my church. And the spiritual aspect is, if I can do it, you can absolutely do it. And I'm using what I have as an opportunity to show people what they can do and not what they can't do. There's a lot of things I can't do anymore. I'm losing a lot of the talents that I have. I had a talent to play tennis. I had a talent to run. The talents are going away, but the gifts that were given to me, that the Lord gave me, I still have, and I'll always have those gifts, so I can use those. So the talent's going away. You just figure out what else you want to do, and you just use the gifts that were given to you and proceed. And it has absolutely changed my life. And I thought about that, and I can't compare myself to others. You can have contentment in your life, and soon as you go to compare yourself to someone else, you lose that contentment in your life, because they either better at something else, or they excel at something else, or they can walk better, or they better looking. And all of a sudden you lose the contentment you had in your life, because you were happy with what you were given. You had joy, and all of a sudden you're letting somebody else take it away. And you can't do that. You just got to be you and address life the way you can.
So tell us a little bit about the awareness work that you've started doing.
So some of the awareness work I was doing, we talk about, Doc, you alluded to the fact that some people want to know all about the disease. Some people don't want to know anything about it. So on social media for years, I never mentioned having anything. So what I decided to do is to bring awareness to it, to help someone else. Because I know in my lifetime, there's probably not going to be a cure, but there's probably a young person that's going to grow in and get the disease, or has the disease. So I thought I'd bring awareness to it. So I decided to walk in a 5K. So I've got a therapist who does blood flow restriction therapy with me, and he's out of Nebraska. And what I decided to do is I said, all right, I want to train for this 5K. So I get out and do road work. The first time I'm wearing my braces, I got my cane, and I can do 1.5 miles, and that's it. 5K is 3.1 miles. So I'm like, I got to do this. So it gets to the point the 5K comes up. I've walked the 3 miles before. I was 181 out of 192. I wasn't last, but I completed it. And the mental part of it was, we got to have victories. We're going to have battles in our life. And that was a battle for me. And I had to have a victory. So at the end of that, in 1 hour and 4 minutes of walking that 5K, I crossed the finish line, threw my hands in the air, and it was a victory. But I had people want to know more about it and want to know what was going on. So I decided, after watching some of the other guys who have inclusion body myositis like me, I had a guy who was throwing out first pitches. Vance Robinson was throwing out first pitches for myositis awareness. And I said, I got a classmate who's the head coach of the Citadel baseball team in Charleston. So I reached out to him, and I threw out a first pitch for myositis awareness. And except for him, because he had heard Advanced Robinson, nobody knows what myositis is. So we got to tell him. I had a proclamation done at our county. Reached out to a friend of mine on council and said, can we do a proclamation for myositis awareness? And he goes, and he knew about it because I told him about it, but I had people on council say, I had never heard of it and didn't know you had anything. You carry yourself like you don't have things going on. They didn't know. And it's the hidden part of the disease that we have. So that brought awareness to it. There was a newspaper editor that was at that council meeting who said, this is great. Can I write a story on you? And if you make yourself available and you submit to what you can do to help other folks, doors will open. The Lord will open doors and give you opportunities like you never had before. So as my progression is getting worse, my hands are getting worse. This is a fist. This is the best I got right now. Getting up is slow. But there's somebody that I encouraged that said, well, he went out and did this. And I know there's somebody that can help who was where I was a few months back that didn't want to know anything about it, didn't want to do anything, that may be able to make a difference to at least one person in their life.
That's amazing. Thank you so much. And all of that is applying psychosocial health to your journey in different ways. So, Dr. Nicole, did you have any questions for Chip?
First of all, what an inspiring story. and the 5K, yeah. Yeah, it's very inspiring for me and for other patients too. The question I had, first you told that you don't want to know anything about the disease, but later on it changed, didn't it?
It did. And
Yeah.
what really changed me, and I'll tell you the story of how it changed. I was keeping it to myself. I live in the town that I was born in. It's a small town. And my pastor asked me one Sunday morning if I would give my testimony. So I went up and gave my testimony, and not knowing that it was going to be on Facebook Live, and I had people start to reach out to me because my church knew about it, and they started reaching out to me and they said, boy, that's an inspiration. I can't believe you're going through this. You know, I'm excited for your journey and knowing how positive you are. And I was thinking the impact I was making that to people that knew me, why can't I make that impact to folks that are suffering through the same thing I am, or that I don't know that I may end up knowing in the future? So I used that as I said, all right, Lord, use me. And he goes, hang on, we're getting ready to go. And when I asked him to use me, that's when it started changing. And that's when I needed to know more and more about it. I started reading books. I started getting on the podcasts that we have, the webinars that we have, the Zoom calls that we have with other patients, and hearing what they're saying. And I'm like, I still can get around well, and I can still make a difference. Why am I keeping this to myself? So that's when I decided to open up to see if I could learn something that could help someone else out.
And what is so amazing is that, Dr. Nicole, we talked a little bit about this before the webinar started, but I was in a bit of a pickle at TMA because I love making sure that anything at our conferences is a holistic approach, like you're talking, so that we do have sessions on things other than just the nuts and bolts of the disease. And anything, you know, one of our conference goals is to strengthen you to where you can make it through the next year ahead. You know, whatever steps are in front of you, and that can look different for each person, like you said, personalizing. And you noticed that the spiritual part was missing, and the TMA a curriculum used to have finding strength through faith that was done by one of our board members, our past board members, who, you know, with the ebb and flow of this disease was no longer in a position to volunteer, and we were left with a vacuum. We didn't have anybody to lead that. And then in steps Chip Galloway, and just doing our volunteer intake and talking to him about his strengths and his passions and his spiritual journey. I just knew this was the right person to carry that torch. So he will be providing that session at our conference in September. And I am so thankful and excited about that. Okay, I've got a comment in here. In the US, most health plans don't cover interventions like ACT. The psychosocial aspect of support tends to not be considered as important as the physical. Do you have suggestions, or is TMA considering offering more programming or support for these kinds of interventions? Can you speak to the importance of certified or accredited instructors? Well, I can talk. I just mentioned a little bit about how TMA wants to include it in the programming. And that's also why we created empowerment clinics. Each month we have Ask the Doc, where we will have people, physicians of different specialties come in, and you can ask your questions. And that's more educational, but we want our empowerment clinics to actually improve your quality of life. And many of them are on aspects that are more holistic in nature and not normally covered. If there is a subject you'd like us to cover that we haven't, please email me at rachel@myositis.org. But Dr. Nicole, did you want to respond?
Yeah, I can add to that the Inspire NMD group I talked about has the aim to create more attention for psychosocial interventions by research, by webinars, etc. Because when we perform research on these interventions like acceptance and commitment therapy, the spiritual approach, hopefully we can tell the health insurance companies that it's very important and it's very effective. But that maybe takes some years, and up till that, we offer, next year we will offer webinars and workshops for healthcare professionals all over the world on acceptance and commitment therapy. It can be offered by psychologists, but in the Netherlands, also occupational therapists, physical therapists, offer a bit of acceptance and commitment therapy into the therapy. So I think that up till the covering of exempt and commitment therapy by healthcare insurance companies. We can do a lot by incorporating it in the usual care. So there's hope for the future.
There is always hope for the future. Oh, well, do you have any questions for Dr. Nicole?
Well, I'm just blown away by what I saw in the slides and how it relates so much. It was very comprehensive. And one thing that really stands out for me and what I wanted to know is when I was at my lowest point, when it comes to the mental aspect of it, I felt so alone. I felt like it was me by myself. And I was diagnosed over 3.5 years ago, and I have never been close enough to someone who has the same disease I have that I can touch them. And I know that sounds funny, but I still feel like I went to see Peter Frampton in concert last month, and that was a treat because I got to see him walk out on stage, and he's got a song that says, "Do you feel like we do?" And I'm up there going, absolutely, I know how you feel. But I felt so alone for so long, and I felt by myself. And when you go to my primary care physician, I said, well, I'm feeling this and I'm feeling that. And he had never heard of the disease. His nurse had never heard of the disease. So as I go to different doctors with my wife or things she may have going on, I ask them, I said, have you ever heard of inclusion body myositis? And they go, well, no. And listening to you talk, you had 100 and I think it was 198 participants that were patients. And that intrigues me because right now I'm the only patient that my doctor has in my hometown, and it makes us feel so alone. So when it comes to sharing with my wife or my dad or my children, I'm still the only one. Mm-hmm. And listen to you talk and the importance of them and the importance coming in. I want to dig more into what you shared with us because it's just amazing. But to me, it's what I can do to help somebody else as I'm helping me.
Yeah. In the audience, I want everyone to know, you may already know that we record these webinars and we put them on YouTube. And I know that there are things that you in the audience are doing to help yourself in your myositis journey. And if you would like to add any of those helpful tips or parts of your journey in the Q&A, you can, and I will be happy to share that. And we can share that with the broader audience when they watch this on YouTube. So I was curious, and I might be putting you on the spot, Chip. Okay. Because there is kind of sometimes, and I don't know about your spiritual community, but in the past there has been negative stigma against seeking out therapy, and you know more of the you should seek out help through prayer. And what is your stance on that? What have you found out in the field as far as are you anywhere near ready to think about something like a septic commitment therapy, or what do you have to say?
My faith is strong, but when you seek help, you may need help from wherever you can get it from a professional. My thought is you have to be around others. You have to be around somebody that's going to ask you how you feel and want to dig deeper into what the problem is and what's going through your mind as you're in those spots, as you're in the peak, as you're on the mountaintop and you're feeling good and you're having a great day, or when you get into the valley. You know, you're going to have to sometimes get help from others. If you don't, sometimes you can't share with family how you're feeling. They're just too close. Sometimes the spiritual aspects, when you're studying, say, well, I need to talk to the Lord. The Lord's with you, but you still feel by yourself and you still may need some more help. And there's nothing wrong with getting that help. There are examples all through the Bible when folks are talking, and I can think of examples where they're saying, Lord, I don't want to do this anymore. I'm done. Just go ahead and take me. and the Lord would send an angel to comfort them. Sometimes that angel comes into the form of a therapist. You know, he's not going to send the winged angel that comes to our mind when we think about it. That angel may be a therapist. That angel may be Dr. Nicole. That angel may be Rachel Bromley helping us to realize where we need to be. So when it comes to that aspect of it, I don't think it's an accident when we seek help and we get help and we need help. And I think it's very important that you get help where you can, but you got to be able to discern the motives and what they're looking for when they're trying to help you.
That's true. Okay, let's see what has come in. Dr. Nicole, how might you partner with U.S. physicians or occupational therapists to make these interventions more acceptable and accessible in the U.S.?
I'm very happy that I've been asked as a presenter at the World Muscle Society in Charleston, USA. So I will definitely tell on acceptance and commitment therapy at that Congress. Another thing what is important, I think, is that it's captured, included into guidelines in myositis, because physicians like guidelines, and when it's in guidelines, it's true. But I was triggered by the word more acceptance of acceptance and commitment therapy. I think in the Netherlands, it's the acceptance of psychological therapy is increasing, but as I read it now in the US, it still has to be accepted, the psychological interventions in the medical world. So I think that we as a Inspire NMD group have a mission to increase the acceptance of psychosocial and spiritual interventions in myositis. So I will do my best.
Right. It's all on you. No pressure. No pressure. All of the Netherlands and the US, that partnership rests on your shoulders. Well, I want to thank, let's see, let me make sure. I think I've covered everything, but I just want to thank both of you for being on the webinar today. It's been excellent as always. And I wanted to let everyone know, if you're interested in going to the annual patient conference, not only is Chip speaking, but Dr. Voet is going to join us from the Netherlands via Zoom, our only Zoom one we have. We're excited to have her expand on these topics, because mental health is so important, whether you're a patient, care partner, family, friend, physician. We all need to be considering that when looking at the myositis journey. So thank you again so much. Did you, either of you, have last words that you wanted to share with the audience?
I would just like to say that as I listen to what we've got going on, we can have this disease as a patient define us, or we can show the strength and work real hard to define it and to show what we can and can't do. And what Dr. Nicole is doing is amazing. And I think that's going to help a lot of folks. And I know it's helped me today. I appreciate that.
Yeah, and I'm inspired by your story, Chip, but also by the questions of the audience. And I'm looking forward to the future and to work on this very important topic.
All right. Well, thank you so much. And we look forward to our next webinar, which is going to be Ask the Doc with Dr. Sonia Danoff, and that will be next week. And until then, I am Rachel Bromley for TMA. Good night. Oh, I just want to say real quick, Dr. DeGroot is on from our medical advisory board, and she says that she is planning to organize a workshop on mental health and myositis during the next global conference on myositis in Pittsburgh. That is exciting. Thank you so much.
Yeah, and she's part of the Inspire NMD working group too. I'm very happy to work with her.
Yes, she's amazing. All right. Thank you, everyone. Have a good day.
Bye.
Bye.